Mute yourself unmuted too. Yeah. That way.
Am I muted? Self unmuted?
Yourself unmuted.
Yeah.
On the.
On my laptop?
Should be able to.
After the conversation, I just wanted to make an announcement that today was first on your way in this morning, there were 2 accidents just around the campus of the university. So we are more close to arrive, a little bit of delay. Facing the background. Keeping folks on time. The accident. Thank you.
Hopefully that was an accident. So. Mute here. We're gonna get the audio off that audio. So start talking.
Was hearing something.
Test 1 2 1 2. Yes. Oh, oh no, that was just. All right.
Like you'll see like.
Mike is not now. There. Use my outside voice. Oh, my. Good morning. It's a thrill to be with all of you. I'm often today, our fever. Before we get underway with our incredibly exciting morning, a few first, if you haven't already, room your morning. The watches are located to the right of the ballroom and to make way for lunch at noon. And finally, for those of us that are close to passing, this grand ballroom during warriors out there and work safe, and they will be that we're ready to kick things off. Just confirming you all can still hear me. Reasons for our coming together today, it seems only a plan. This acknowledgement is developed by the Maryland State Arts Council on behalf of the city. We acknowledge the lands and waters now known are the home of the first knowledge. Since the coming of colonialism. Knowledge that this is land Acknowledge the degradation that continues to be wrought on the lands and waters in pursuit of resources. We acknowledge the right of the land and waterways to heal so that they continue to provide food and medicine for all. We acknowledge that it is our collective obligation to pursue policies and practices that respect the land and waters so that our reciprocal relationship with them can be fully restored. This morning, we've gathered to talk about an issue that is foundational to the work that we all do in this room, the work continuing to advance health equity. Really, the need to continue advancing liberatory models for achieving health equity, because effectively addressing inequity in deep-rooted, complex systems requires liberatory design. The national, what is liberatory design, you might ask? Well, the national defines liberatory designs that help interrupt inequity and increase opportunity for those most impacted by oppression, that transform power. Steering our focus toward fairness, justice, and equity these last 2 decades. The office is equally lucky to have the support of the Maryland General Assembly. From former Senator Shirley Nathan Pulliam, who introduced the legislation to create the office in 2004, to all the legislators who have worked with her and who continue to work to focus on reducing health disparities across the state. We thank you for your ongoing attention to these important issues. We are hopefully lucky to have Senator Nathan Pulliam with us this morning. I've spoken to her a couple of times, and she retired from the General Assembly due to ailing health, but she is going to rally as best she can, and we hope to celebrate her later today. And I look forward to sharing more about her accomplishments with you, whether she's here or not, later in the program. I would also like to extend my deep appreciation to Governor Wes Moore, Lieutenant Governor Aruna Miller, who is on her way, Secretary of Health Laura Herrera Scott, Deputy Secretary Alyssa Lord, who will be hearing from later, Secretary of Aging Carmel Rhodes, and Secretary of Veterans and Military Families Anthony Woods, also stuck in traffic but on his way. Actually, he is right there. as well as NBA racial challenges by the NFA, sharing your wisdom and insight with us today. Leadership and commitment to addressing health disparities and advancing equity for all Marylanders is unparalleled and not serve as a sign. Finally, a debt of gratitude to the Morgan State University Choir, who despite an incredibly busy national, international travel schedule, graciously agreed to close out the morning session with their amazing artistry. Together, all of you in this lives in moving to health. As we look to the future, our collective action will continue working economic opportunity, mental health and wellness, while continuing overall. We will also commit to targeting investment to dismantle the root causes of health inequity. And we must absolutely continue centering the vision and leadership of our community partners doing this work on the ground. Advancing health equity is the long game. We know this. Change doesn't happen overnight, but it must happen. So we have to all join together, government, philanthropy, academic, business, and remain vigilant and relentless in our pursuit of fairness and justice for all. The Office of Minority Health and Health Disparities looks forward to continuing to work together and deeply. As we go through the day, my hope that you make many, many new connections and are able to expand your health equity toolbox with the innovative ideas and approaches utilized by your colleagues across the state who are disrupting and building new mousetraps that can be sustained into the future. That, a word of Governor Weston. Thank you, Governor Moore. Carry the national leader in healthcare delivery campaign, telling me not to be the buyer. Good morning, everyone. And I have the pleasure of working. Our department is done that all my applicants deserve the opportunity to maintain the highest level of health. And it's certainly our collective goal to meet people where they are, first, where they are in their health concerns, and they handle systems and initiatives necessary for a better response. We know every grants and the grants go away, the programs go away. So we're certainly thinking about long-term sustainability to ensure that the program is Base conference, we include a lot of the work we've done over the last year. We are making progress. We know a lot more. From day one, when I took all this last year on the day of the inauguration, we knew it that data was a priority. And the first months, my time in office, we established a data office as a role of data officer. And the final will be very proud to say, 50% of some of the data initiatives that are office and why that's based for. The office is specifically focused on applying the health equity lens to data by identifying relevant super determinants and disaggregating data by breaking determinants such as race, ethnicity, income level, education, geographical location, and disability status. Identify disparities and understand how this different groups experience health. Data sets that are communicating. This is the way we are developing our data sets. And for the data set that we have now, when it's available, when this data is available for Medicaid, we are going back now. Start looking and making sure that as we evaluate the data, we are looking at those parameters when we have that data available. So our intervention now considering, in addition to that data set, the partners to effectively identify data needs, finding, co-development interventions. So you'll hear later that we're starting data out of the community, but you don't have to access the data. Now we can sort the data by the signal very different and be able to filter on our own what it's looking for based on the signal where you live and here's the population that is served. So we work on that. I want to steal the thunder and I stole a little bit already, but we learned about the progress that we're making from a data perspective, and based on the dashboards that we've successfully launched. And you'll also hear about a little bit about AI and the future of AI. Not only the promises of AI, but certainly the concerns that come with AI and the biases that we need to watch out for as we move forward. Then, second after we got the data office, I said, I really need a bold leader for this. So area we are to see health plans. I don't care if you're very moved, very story. But I'm 45% Baltimore. And Baltimore is very black right now. And I got to get this role. I don't know what I was exactly. And first time I went out to eat, we were at a Mexican restaurant and people asked me what was good on the menu. And I was like, I don't know, try it. I just said, I figured that it's not all. So it was really important for me that not only was someone totally responsive, but and I met the real fall. It was a quick last Friday, and I guess it's very time I think that. But immediately, person just about and heard me getting our starting. You were. So, but then he also had a vision as well. And just me, so her role in the two of us trying to drive this. And she had a vision for creating a role with a health equity liaison. And having these health equities based on that department, very ambitious as we always my article and health disparities. So how do we do that? So that's the two work extra. And so maybe the jobs that work with each of the health And the liaison shares responsibilities as a collaborator for connecting the development, implementation, and application of health equity practices across the department. So one example of someone that takes role on develop a project that analyzes the equity of reach and equity of impact of their program by assessing enrollment and outcome data, comparing it to statewide and county population estimates by race and ethnicity. The analysis